So you've got 3,300 infections that have been recorded among workers in Victoria hospitals and aged care homes to begin with. Greg Hunt says that not enough is being done to protect workers. So what's your view of that? What's going wrong?
We tend to agree. I think particularly in Victoria, there has been a failure of things like making sure that there was fit testing of masks, there was proper training, and also that the correct masks were given. And I think there's this underlying other concern from the AMA that the advice about the type of mask being used has been for the lower level sort of surgical masks until now. And our view has been that, particularly given the fact that this is not just a public health issue when you're in hospitals, it's a safety, occupational health and safety thing. You should be applying a much higher level of care and protecting those workers having to see people with COVID, and that the higher level of masks and protection should be applied. So, look, I think there has been some problems there. We are now supporting the Minister in making sure that there's much clearer monitoring now to work out exactly what the failure is and to make sure that the absolutely highest standards are applied to supporting workers so they can feel safe going to work and not feel like they're going to go to work and not come back.
So how significant are the shortages when it comes to those masks, which you say are not up to scratch, but also the protective personal equipment?
Well, it's probably, it has become probably a little bit more, but I don't think that's really been the main problem. The problem has been until now that the advice, for example, for the mask has been for the normal sort of rectangular surgical mask for routine care of people with COVID. And really, the AMA's point of view was that, and that's based on droplet spread, that, it's short, like it's mainly just within 1.5 metres. But there is increasing evidence, for example, that there is a thing called airborne spread where the micro-droplets can stay in the air for much longer. It can be inhaled around the sides of the mask. And so the AMA's felt really that we should be, for people that are actually working with people with COVID, that we really should have the high level masks that stop the sort of droplets getting around there and protect those workers. And so, look, we do need to look at that, and we are supporting much higher levels of monitoring now to make sure that we get the best advice and the best protection for those frontline workers.
OK, well, aside from masks, though, is there enough PPE? Is that up to scratch?
Well, there was, frankly, a complete bun fight, frankly, piracy in the high seas. And Australia did quite well in obtaining masks early on. We are now starting to manufacture them now, which is great. In South Australia, there's places manufacturing. So we are in a much better position. But there's still a problem, for example, in making sure, as I said, that there is the right type of mask and that the masks are fitted to everybody. And, for example, in Victoria, my understanding is they didn't start off with that. But in South Australia, everybody got fitted quite early on. So, there's a big discrepancy across the country. And this national coordination is probably something that we need to look at to make sure that it's across the board for those frontline workers.
Hey, Doctor, there's some interesting comments that have been made overnight in the Herald Sun this morning from the boss of CSL, which, of course, is going to be the Australian distributor of the vaccine that AstraZeneca comes up with whenever that happens. The government's still trying to maintain positivity, despite yesterday's news that there was a problem with the trials, and still expects it to be delivered at the start of next year. But the CSL boss says, quote, "Don't bank on a vaccine." Do you agree?
Yeah, I'm not. I think we hope for the best, but expect the worst. Look, and with regards to the AstraZeneca vaccine that had the problem with one patient, look, things are never as bad as they are and never as worse as they sound. It does sound like one individual had a reaction, but it may have nothing to do with the vaccine at all. So, look, there's a lot to play out, and I suppose there's been too much focus on one vaccine because at the moment there are a lot of candidate vaccines. They're still quite early in their development. I think there's a long way to go, and what the government is trying to do at the moment, which is correct, is try to hedge their bets for as many of these as possible, because we're hoping that at least one of these comes through for us at some stage. But there is that small chance that it may not. I mean, there has never been a coronavirus vaccine actually successfully created, so we do have to also consider that as a possibility.
What do you think is a more realistic timeline for availability?
I think mid to late next year at the earliest, probably. Yeah. I think this thing with the AstraZeneca one, where we were, people were talking it up for early next year, was just quite unrealistic. These little road bumps occur with everything, and we do need to make sure that it's safe. even though, at the moment it's unclear even that this was caused by the vaccine at all. We need to make absolutely sure that it's safe before everybody gets the vaccine.
I mean, it would be frightening, and some of the information, Doctor, that was coming out yesterday from this particular person had back seizures that could, end up leading to some kind of paralysis. And you rightly say maybe it didn't have anything to do with the vaccine, but still might frighten people. So do you think that the rushed vaccine, having seen what it might have done yesterday, might lead people to think, well, maybe I don't want to take it?
It's not been rushed. I think the problem is I think what we're finding out, the community is finding out how science works at the moment and the process, and that it's slow and painstaking, and that you do need to make sure that things are safe, that they work, that they'll work for the long time, and that needs to be done firstly over a large number of people. And the next thing is that it needs to be done so that it's compared against what we call placebo, where we actually don't know what somebody's been given, and it's revealed only later, because this is the way it happens. And as I said, I think people should not get too worried about what happened yesterday, because things are never as bad as they seem. Yeah. But it is a slow, painstaking process, which is the thing that's a bit frustrating for all of us at the moment.